Confusion quantified, patients' limited knowledge of their contrast allergies. We sought to compare patients' knowledge of their iodinated contrast allergies to expected knowledge of other medication allergies and use this information for patient care and workflow. Other studies show that only 60 to 70% accuracy can be expected when asked patients to name their drug allergies. That accuracy improves with pharmacist counseling. Our hypothesis is that patients are much less likely to be able to name their iodinated contrast allergy compared to other medication allergies. Of course, iodinated contrast is not a single drug, but a class of agents, including older and newer agents. Iodine itself is a mineral that is essential. We all need it to live. It's in our thyroid hormone that regulates cell metabolism. But the word iodine, unfortunately, is still used in a slang and formal way to refer to at least three unrelated things, including iodinated contrast, iodine soap, and sometimes to shellfish, even though that allergy is to a muscle protein. All of these are unrelated to iodinated contrast, and misinformation results. Our study used a keyword search in our medical information system and a questionnaire. In a 6-month period, we identified nearly 16,000 patients having CT studies. Initially, 3% were flagged as having a possible contrast issue, but after excluding patients for reasons outlined, only 2% of our subjects were included, which was a cohort of 306 patients who definitely believed they had had a prior contrast allergy. When asked what their allergic symptoms were, 87% could tell us. When asked when did their allergic reaction occur, over half could not tell us. 1/3 were able to estimate the year, an additional 7% said it was a long time ago. And knowing when a reaction occurs is relevant because the allergy may have been to an older ionic agent no longer used in your department, but patients were unable to estimate over half the time. Knowing where the reaction occurred would be useful if old medical record retrieval is possible, but 59% were unable to identify either the city and state or the facility by name. And when asked, what is the name of the contrast agent that you are allergic to? Remember, 60 to 70% of patients are expected to know their allergies by name. 60%, the low end, would predict that 184 of 306 could name their contrast allergy, yet in our study, only 5 patients of 306, 1.63%, were able to name the agent that they're allergic to with very strong statistical results. Because only 5 out of 306 could name what they were allergic to, it was easy to go back and ask, how did you know what you were allergic to when most patients with a contrast allergy do not know? And those we could contact said simply that a technologist or radiologist told them the information at the time of their reaction and gave it to them in writing. Our results conclude that patients with contrast allergies are markedly uninformed about their own allergies. And we also discovered that there are patients with unrelated allergies who still fear that they should not get IV contrast and decline the injection. There are uninformed ordering physicians who do not order contrast CT or CT at all due to unrelated allergies. And some technologists and radiologists still confuse these issues and sometimes cancel studies for the wrong reason. Our recommendations: we continue educating people in the healthcare field and patients. When a reaction occurs, the technologist will write that agent into the electronic medical records and provide that information in writing to the patient. Radiologists will dictate the information in our reports. If your practice asks patients specifically, are you allergic to shellfish or iodine soap, we encourage you to discontinue that practice, since those allergies are unrelated to iodinated contrast, and asking the question implies relevance that is not actually there. And we also recommend that the informal word iodine not be allowed as a valid allergy in electronic medical records systems, since it is nonsensical. We also recommend that the word iodine not be allowed as a valid allergy choice in electronic medical records systems, since the word means different things to different people, making it nonsensical.